R. Menon will talk on impact assessment of telemedicine services to an island.
I want to brief you about a small study which we conducted in our telemedicine center at Amrita Institute of Medical Sciences, Kochi. This study was primarily aimed to evaluate the impact result of the telehealth services that was provided to the island center from the last 3 years. The problem basically with the island center was it was located in a location called Shadipur, which is it's a very remote location, which is away from the capital, Port Blair. Second issue was the scarcity of specialized healthcare centers in these islands. To bridge this gap, what we did was we made teleconsultation a standard of practice for all the patients who came to the health center in the island. Video conference was done using Skype, and the patient data was exchanged using the Amrita Health Information System. Thirdly, what we did was specialized tele-healthcare plans were given to the doctor at the island center as a part of the chronic disease management protocol. So this avoided confusion when to connect and when not to connect. For example, for a diabetic patient, a known case of diabetes, once the primary consultation with the physician at the island center is over, screening requirements are identified, teleconsultations are done with ophthalmologist, endocrinologist, podiatrist, and a dietitian. After which, regular follow-ups are scheduled and charted out for the same patient. In the last 3 years, that is since 2009, we have done 3,895 teleconsultations, which are paid teleconsultations from the island. This includes 3,705 real-time, 190 store and forward. Telecounseling, 281, follow-up care, 220, inventory control and administrative teleconferences, 28. The objective of the study was to assess the patient satisfaction in teleconsultation. Secondly, to assess the physician satisfaction in the same. The sample size of 94 patients and 37 doctors was selected for the study. Non-probability convenience sampling method was adopted for the study. Mainly 2 types of data were collected. The primary data for the study was collected through the questionnaires, observations, and data from the hospital information system. Secondly, the secondary data collection was from the medical records. Data analysis was done by percentage method. Limitation of the study was the sample size taken for the study was 94 because of the shortage of staff at the island center. Secondly, sample of 94 patients was taken at the stage where monthly an average of more than 120 teleconsultations were happening. Data collected from patients at the island health center was through verbal feedback records. To assess the physician satisfaction level, separate written questionnaire was administered to doctors at both ends. 91% of the doctors, 91% of the patients were satisfied with the teleconsultation. Only 9% were not. 62% of the doctors were satisfied, 16% of them were strongly satisfied, and 19% were neutral. Only 3% were dissatisfied. The rating of telemedicine programs in updating knowledge, 51% agree, 11% strongly agree, 33% no comments, and 5% disagree. The suggestions given by the study group was the improvement in quality of connectivity to the island will increase the perfection and communication between the ends. Doctors who understand the local language of the island will be an advantage, and this will decrease the communication gap. Senior doctors' visit to the health center once in a month will be helpful to the patients. These are the images of the teleconsultations that has been happening. In the conclusion, teleconsultation can arrive at a definite diagnosis more quickly and a comprehensive treatment plan could be initiated without losing time. The travel and transportation from island to mainland is considerably reduced. Teleconsultation can avoid a lot of unnecessary follow-up visit and can provide the same level of satisfaction. Thank you. Yeah, sure.
Go ahead.
I wanted this presentation to be in the main hall, but unfortunately.
Patient satisfaction 19% is understandable because for them something is better than nothing.
Yeah.
But doctor satisfaction is just about 60%. When all along we have been hearing that telemedicine is a force multiplier, it will boost the morale of doctors, it will expedite or enhance. But satisfaction, what do you think the reasons why there is such a low level of satisfaction?
There are multiple reasons for that. One is the connectivity was a big issue during these 3 periods because the satellite was the back end, and that to a Malaysian satellite. So there was a lack of proper bandwidth. So even Skype, which is a very robust software, was finding it difficult to operate in an unstable bandwidth. Almost all the tele software which we use as even for a demo was failed in Andamans because of the low and unstable bandwidth. We requested ISRO, we requested BSNL, then all of them told that we can't do anything with the satellite part because we are using a Malaysian satellite. We have to wait till the ISRO's next launch when they are going to send the C-band transponders. So now it has become much better compared to last. So this was one of the reasons doctors were not satisfied because of frequent interruption. Yeah. Secondly, some of the doctors were not used to it because they come from different part of the country. They are not used to the teleconsultation thing. So they have a inhibition in giving the consultation because they feel they are not much confident in the doctor at the island center. So all those things were the issues. But overall, it is a promising scenario. The patients are used to teleconsultation in the island. So they come and ask the doctor that can they have a teleconsultation with a dietitian because of obvious reasons.
Thank you. Thank you very much. Yeah, thank you.
Thank you, sir.